my supervisor is Dr. Mashitah. Okay, for COVID-19, we can diagnose them as a suspected case, probable case, confirmed case, and also as PUS. For suspected case, a person who meets the clinical and epidemiological criteria can be like, they will have acute onset of fever and cough, or acute onset of any two of the symptoms or more lah, such as fever, cough, general weakness, fatigue, headache, myalgia, sore throat, coryza, dyspnea, anorexia, nausea, vomiting, diarrhea, and altered mental status. For the epidemiological criteria, residing or working in an area or locality with high of transmission of virus, which is closed residential settings such as prisons, immigration detention reports, anytime within the 14 days prior to sign and symptoms onset, or if residing or travel to an area with community transmission anytime within the 14 days prior to sign and symptoms onset, or if they're working in any healthcare setting such as healthcare workers, anytime within the 14-day prior of sign and symptom onset, and also a patient with SARI, severe acute respiratory infection, with the history of fever or fever more than 38 degrees Celsius and also cough, which is also with onset within the last 10 days and who requires hospitalization. So for this type of patient, we consider it as suspected case of COVID-19 infection. Okay, next, for probable case, when we diagnose for probable case for COVID-19 infection is when a person is either alive or dead with a positive Rtk test and also suspected case with if there's any chest imaging showing suggestive findings of COVID-19 disease Later I will talk about the chest imaging. Kita criteria.
COVID.
A patient who meets clinical criteria above and is a contact of a probable or confirmed case or linked to a COVID-19 cluster. And also, we can diagnose probable case COVID-19 for person with recent onset of anosmia, which is loss of smell or loss of taste in the absence of any other identified cases. Patient who is dead also, who is not otherwise explained in an adult with respiratory distress preceding death and also contact of a probable or confirmed case or a link to a COVID-19 cluster. Okay, next we confirm COVID-19 infection for a person with positive Rtk test and also positive PCR test. This one can be either patient alive or also patient who is dead. We can take the test who is patient dead. Also, we can take PCR to confirm the case as COVID positive infection. Okay, so we can see the chest imaging chest radiography, chest CT scan, and also ultrasound of the lung. From these three types of scan, we can see the findings whether the patient is infected with COVID-19 or no. For X-ray, we can see hazy opacities, which is often rounded in morphology with peripheral and lower lung distribution. For chest CT, we can see multiple bilateral ground glass opacities, often rounded in morphology with peripheral and lower lung distribution. However, for the ultrasound of the lung, we can see thickened pleural lines, B lines, and also consolidative patterns with or without air bronchograms. So, for the patient under surveillance, we can call it as PUS also for COVID-19. If patient is asymptomatic, we can treat them as HSO Can put gelamping and we can send them to home. Okay, so I will talk about the antigen and molecular test. Actually, the SARS-CoV-2, we can also call it as coronavirus. They have three types of diagnostic tests. One is PCR, antigen, and also antibody test. For the antigen and molecular test, the diagnostic tests are used to detect the current active infection of the coronavirus. The diagnostic test can be antigen based, which look for protein markers on the outside of the virus, or they can be also molecular based, which is PCR test. PCR test, we look for viral genomic material specific to the coronavirus. Okay. So how we do the antigen and molecular test, how it works, it's like actually the virus, they require a host to replicate, and how they does produce more viral copies of itself. And then the genomic material for the coronavirus is, we call it as RNA virus, which remains in our body while the virus is still replicating and reproducing. So the molecular test amplify this a bit of viral RNA so that viral infection can be detected using a specialized test. Okay, so I will move on to the first test as Rtk test. We can also call it as rapid test kit and antigen test lah. Okay, Rtk is carried out to detect viral proteins related to the COVID-19 virus to determine active infection. However, we call it as a diagnostic tool, but we can also make it as a diagnostic test if there is a prevalence more than 10%. If we got any clusters, confirmed clusters or the targeted group lah. Okay, so when we use Rtk test, okay, this is considered as MOH as an alternative to PCR test in certain circumstances, which can result in a shorter time frame, approximately will take 15 to 30 minutes to result, and then allow rapid identification of infected people, which avoid further virus outbreak in a setting. So if like a cluster, all we can take Rtk test lah, and it's faster also compared to the PCR. Rtk also comes at a lower price approximately 120 ringgit per test compared to PCR. PCR is like 240 ringgit approximately. Okay, and then the test would need a specimen taken via nasal or throat swab and also saliva samples. The accuracy and limitation, however, the disadvantage of Rtk is that it has a lower sensitivity rate compared to PCR, which is 60 to 80%. Indicating a higher risk of false negative especially among asymptomatic people. So if patient with asymptomatic, they can be asymptomatic. If we take Rtk, if resulted as negative, to confirm it, we also must take PCR because PCR is a gold standard test. Okay, Rtk detects SARS-CoV-2, we can also call it coronavirus protein, and and can be used as point of care testing, as I said just now. Okay, it's considered as a screening test, while PCR, we use it as a diagnostic test to define a COVID-19 case due to its limitation to sensitivity and detection rate range of CT value. Okay, like I said just now, Rtk can be used as a diagnostic test as well for targeted group or confirmed clusters when there's prevalence more than 10% identified by the local level, or check positivity rate by PCR on rolling 7 days or any situation.
Okay, Jaya, just go back to the previous slide. Okay. What's the difference between screening test and diagnostic test?
Okay, screening test, mainly we take Rtk as a screening test because we want as a faster result If patient comes with symptomatic, we can take Rtk first, and then we can know whether the patient is positive or no. If the patient is if the Rtk resulted negative, we can proceed with PCR if patient still symptomatic.
What I'm trying to say is, what do you understand by screening?
Screening is like we screen the patient or anybody if they come with symptoms, if they're symptomatic.
Okay. Okay. Screening ni maksudnya when you're doing mass testing, you just you just want to tapis lah. You've got a lot of sample, you've got a lot of patient. Tapi how you gonna separate patient mana that you want to do diagnostic test. Maksudnya you need to test a lot of patient lah, so that you can
Okay.
the test doesn't need to be sensitive. It doesn't need to be super sensitive lah or super specific. It just need to be sensitive enough to pick up a number of people lah. And screening test ni you certainly expect a certain percentage will be false positive or false negative lah. That's why lepas tu you kena confirm dengan PCR. The other issue is why Rtk ni normally screening test kan? Why dia boleh jadi diagnostic test pula? Apa syarat dia? You baca, tapi I just want to make sure that everybody is clear lah. Bila Rtk ni, it's normally a screening test, bila dia boleh jadi diagnostic test?
Okay, when we see a cluster place, or it's like when there's many population infected with coronavirus, we can screen them with the Rtk test lah.
Okay, it's just in the last sentence lah. When the prevalence of the disease to more than 10%, the prevalence of patient with coronavirus is more than 10% of the sort of local population dan semua, that's when Rtk tu akan jadi diagnostic test. So that's why kalau you tengok masa outbreak, I think Julai, Ogos hari tu, masa kat Penang or KL, dia orang tak pakai PCR dah to diagnose COVID. They semua pakai Rtk je. Your Rtk positive, you're positive lah. They don't bother dengan PCR dah. Because at the time, the prevalence of patient yang positif tu is more than 10%. Tapi siapa yang nak determine whether the prevalence is significant enough? KKM lah. Itu yang hari-hari everybody check statistik tu. Kan? So, KKM boleh decide. Masa tu tempat mana yang okay, the prevalence is high, just pakai Rtk je. No need to buat PCR. So in a sense, it's to lessen the burden on the PCR punya lab lah. So just understand Rtk ni mostly screening test, tapi kadang-kadang in this certain situation dia boleh jadi diagnostic test.
Okay, understood. Okay, I'll move on to the indication of using Rtk test. Okay, when we take the Rtk test is when we screen for emergency and semi-emergency procedures or surgical cases with high probability of COVID-19 infection, and also patient who brought in that lah BID cases with high probability or high suspicious of COVID-19. Screening for SARI patient following the guideline on management of patients suspected with COVID-19 in health clinic by the Family Development Division and also Disease Control Division. And also for EMCO lah, if they discover EMCO with a wider coverage of we do screening and also screening at the country's entry point. When we go to any country, when we want to go to other country, they will take Rtk test. And screening identified or determined by the MOH team. Okay, so what are the requirements for Rtk test? The sampling procedure should be done by a trained personnel and also usage of appropriate PPE lah. And the request for Rtk testing should be informed to the lab personnel first. The laboratory is responsible to provide suitable swab lah for nasopharyngeal swab and also empty container upon request. When we request, they have to provide us the Rtk sample lah. And then the usage of falcon tube is preferable lah, or any empty container with a length of at least 9 cm for the Rtk test. And then the test must be carried out using BSC in the laboratory due to safety reasons. And all the tests must be registered in SIMCA lah, which is Sistem Informasi Makmal Kesihatan Awam Outbreak. Okay, so how we prepare the Rtk test? So the sample should be sent in plain container and not in VTM. VTM is viral transport media lah. And heavy blood stain swab means they will reject the sample lah. So try not to take with blood stain all.
Okay, so be aware these are things that korang pun, sebab korang pun buat swab kan. So these are the things that you need to pay attention to lah. So kalau masa ambil swab tu memang dah nampak blood stain, then don't bother sending lah, because you know it's gonna be rejected. So either clean the nose and re-swab immediately, or yalah kalau memang tak boleh, inform lah person in charge, specialist ke penyelia ke, so that we can consider other methods, because uh, PCR punya test tends to be not as sensitive lah. Because macam some blood stain swab yang tak boleh buat RTK, tapi sometimes that swab can be used for PCR. So that's why kalau you memang buat sekali nampak blood stain, I think second time pun blood stain, then I think the next thing to do is to discuss dengan either EP on site ke, EP in charge, ataupun beritahu penyelia, so that we can consider other alternative. Jangan dah nampak blood stain, hantar juga, because it's just gonna be a waste of everybody's time lah. Nah, carry on.
Okay, swab and swab container and all the test device and also extraction buffer tube must be discarded lah into the biohazard bag once the test is done and sealed properly to avoid exposure to the other staff lah. And then the test must be read according to specified time, especially if processing multiple specimen in a batch. Preferably not to do more than 10
bawah tu tak
specimen.
perlu, yang the rest tu tak perlu into detail lah, sebab we don't do our own RTK kan, we always send to the lab. I think the first 1, 2, 3 tu it's really relevant for you guys lah kan, sebab korang pun ambil kan.
Okay, I'll proceed with the next slide. Okay, how we interpret the Rtk test result? Okay, it is interpreted as per the manufacturer's insert kit. As advisably, the result should be read by 2 lab personnel lah. Okay, positive Rtk test shall be interpreted as a probable or confirmed COVID-19 cases based on the latest case definition, as I said in the previous slides. Positive results should be considered in conjunction with the clinical history and epidemiological history. Negative result may warrant PCR testing or RMT testing if clinically indicated at discretion of clinician. Okay, invalid test means kena repeat new specimen. Alright, so reporting the result, the positive result shall be informed to requesting doctor as soon as possible. When the RTK noted positive, they should call and inform as soon as possible to the doctors. And then the requesting doctor must notify positive result to the patient and PKD as soon as possible within 24 hours. And all the results should be key in SIMCA within 24 hours.
Okay. Itu yang kerja lab lah.
Okay, this is the flowchart for coronavirus rapid antigen testing for Rtk testing. So we perform the test according to key insert. If positive means we do PCR lah. And then send new sample for PCR within 24 hours. Okay, if the test is invalid, also PCR in a new sample. Okay, this is the flowchart for coronavirus rapid antigen test for diagnostic testing. We state to decide on usage of Rtk test as a diagnostic test for targeted group or confirmed clusters as when the prevalence more than 10%. Check the positivity rate by PCR on rolling 7 days. Then we use Rtk test as a screening test only. If the positivity rate of PCR more than 10%, we use Rtk test as the diagnostic test lah. And then we state to inform National CPRC on decision to use Rtk test as a diagnostic test for specific group or cluster. And once the positivity rate becomes less than 10%, a concordance test must be done at a state or PKD level. So the concordant test, 5% samples of the week, which is both positive and negative, should be sent for both Rtk and PCR. And when the concordant test result less than 85%, we use Rtk as a screening test. And if it's more than 85%, we use as a diagnostic test. Okay, I'll move on to PCR test. We can also call it as reverse transcription polymerase chain reaction test. It is performed to identify RNA from the virus, from the coronavirus. Okay, the accuracy is recognized as the gold standard lah. So we use mainly PCR test as a gold standard recommended by the MOH lah as a diagnosis of active COVID-19 infection, which is due to higher sensitivity more than 90% and specificity more than 97% among other diagnostic tests. Test sensitivity means is the ability of test to correctly identify person with infection, whereas test specificity is the ability to correctly rule out the infection. Okay, for the limitation, since the test requires more sophisticated process and equipment, it's a bit tough to do the PCR compared to RTK. And also higher cost lah per test compared to RTK, and also it takes time lah, longer turnaround time, around 1 to 3 days. And the result, positive result indicates most likely that they have been infected with COVID-19 virus infection, and positive results should not be repeated within 90 days when the person is tested PCR positive, cannot repeat the PCR for 90 days because the fragments is still there and it will be still detect as positive lah. Okay, so indication transplant cases will be screened using PCR instead of RTK. PCR is also recommended to screen for SARI patient as severe symptom who is having severe symptoms and presentations in SARI patients, which is highly suspicious of COVID-19 infection. Okay, so this is the flowchart for coronavirus in suspected case of COVID-19 as outpatient setting. Okay, this one can it's briefly explained in Annex 5B, but I'll just roughly tell. The suspected case of COVID-19 at outpatient setting, we can collect the specimen. It's all written in Annex 5B lah. The guideline there, we can further read there lah. So we place the combined nasopharyngeal swab and oropharyngeal swab in viral transport media. And then we send the specimen in gold chain lah, which is keep the specimen 2 to 8 degrees as soon as possible to the designated laboratory lah in triple packaging. And then do the PCR test. If the coronavirus is detected, we admit to ward. And if the PCR test is inconclusive or invalid, we have to repeat the PCR test on same specimen. And if it's again invalid, we have to take the PCR, repeat the PCR in a new specimen within 24 hours. If the coronavirus is not detected in the PCR test, then we can send patient as a home surveillance order lah, HSO. Okay, for the flowchart of rapid test kit antibody for home surveillance HSO on day 13, we perform RTK on day 13. If positive means we perform oropharyngeal and also nasopharyngeal swab for the PCR test, and if it's detected, we admit the patient. If it's inconclusive or invalid, we repeat the PCR on the same specimen. And if the RTK resulted as negative, we discharge from HSO lah. Okay. So I'll briefly tell about the difference between RTK and also PCR test. Okay, mainly PCR we do to identify the presence of virus, which is RNA virus, whereas the RTK is to detect specific virus protein, commonly known as antigen. The PCR, we take sample from two places. One is nasopharyngeal and also oropharyngeal swab. We can also take it from the saliva, but usually oropharyngeal and also nasopharyngeal. And RTK also same lah, nasopharyngeal and oropharyngeal. So if the PCR test is positive, the individual is memang known to have the virus lah. Whereas when the RTK is positive, we call it as the patient is infected with coronavirus. So the PCR, what is the benefit is the gold standard lah for diagnosis of COVID-19 virus infection, which is having high sensitivity and specificity. Whereas RTK test is only high specificity, and one of the benefits, like as Dr. Fairul said just now, able to detect in outbreak quickly lah, and in large population in shorter duration of time. Yeah, it is also lower cost as I said just now compared to PCR. Okay, for disadvantages of PCR is risk of mutation in virus gene can render false negative result. And however, disadvantages of RTK is poor sensitivity lah. Higher risk of false negative to be confirmed with RT-PCR and considered as alternative to PCR as preliminary screening. The turnaround time for PCR is same day or can be up to week, but usually up to 3 days. Whereas for the RTK is 15 to 30 minutes lah. Okay. Okay, next I move on to RMT and also gene expert test. Okay, this one, RMT and gene expert is mainly will be requested by the physician lah. Like HO or MO cannot request this. This one, the RMT and gene expert test can provide result within 30 minutes. The accuracy is rapid PCR test.
Why HO and MO cannot request RMT or gene expert?
Because they have a few indication if patient with high risk or if like needed with any indication to need to know the result as urgent as possible, then we request
So
for
kalau patient ada indication, specialist tak ada. So houseman dengan HO macam mana? Jangan salah faham. Dia bukan houseman dengan MO tak boleh request. Dia in the end it boils down to cost lah. Cost and benda ni is limited because it comes in a kit kan. So it's a kit and you got limited amount of kit. So you can't bagi every Tom, Dick and Harry buat gene expert or RMT, nanti habis lah. Then when you have patient that really needs it, dia akan tak cukup. And then of course it's expensive lah. Tapi it doesn't necessarily mean specialist je boleh minta. It's just that if you need to buat, you need to talk to the pathologist and explain your reasoning. If pathologist kata your reasoning is fair, dia buat lah. If they think your reasoning ni macam, you know, doesn't change management ke, or macam doesn't ni, dia tak bagilah. It doesn't mean that kena specialist je, tak. You have to discuss dengan pathologist if you think that ada reason. The RMT ni is also PCR punya test. You need to understand the difference between gene expert or RMT ni or rapid molecular test is also a type of PCR punya test. Cuma the difference between RMT gene expert punya PCR ni compared to your real time PCR kan, your RT-PCR that Chia was talking about before this. PCR test ni actually refers to the machine, the polymerase chain reaction punya machine tu. And yang ada dekat lab, this machine can be adapted to test for any viruses as long as they had a genetic sequence of this virus. So bila masa COVID first outbreak dekat China, when China release the genetic sequence of this virus ni, that's why all the lab in the world boleh terus buat RT-PCR to detect this virus. Tapi as you may understand, dia machine yang fix lah. So lab yang memang dah siap-siap ada PCR punya machine tu, boleh lah buat. Tapi if you suddenly I want to build a lab yang capable of buat PCR test ni, you know, it's gonna take ages lah kan. It's not like something kat 7-Eleven ke apa semua. So to set up RT-PCR punya facility tu, it takes money and it takes almost macam permanent structure. So come this company, okay, we create this rapid PCR test ni lah, gene expert RMT ni. Dia PCR test tapi dia very specific untuk COVID sahaja. So it's a machine yang memang untuk COVID je. Dia tak boleh test PCR lain lah. So say in the future you ada outbreak lain, virus lain ke, this machine will be useless lah. This machine will be useless. Tapi the PCR yang kat lab tu can be adapted to test for other viruses as long as we have the genetic sequence. Understand? That's why this one lagi cepat and cheaper than the real time PCR tu. Tapi The disadvantage is once dah habis cerita pasal COVID ni, you boleh buang je lah all this thing. Dia punya and dia punya machine tu is basically useless lah in other situation.
Okay, Doktor.
Tapi dia punya sensitivity and specificity, accuracy dan sebagainya just as good as your RT-PCR. Okay?
Okay, faham. Alright. Okay, so with the advancement of technology, research and development, so the real rapid PCR platform they have introduced as Gene Expert and also RMT. We can provide the result within 1 to 2 hours lah, which is available in hospital laboratories in MOH. So rapid PCR allow faster case detection, diagnosis and management of the COVID-19 patients. So there are 2 rapid PCR tests available in MOH facilities. One is Gene Expert and one more is QIA Stat DX Respiratory Coronavirus Panel lah. Okay, first I'll talk about Gene Expert. The Expert Express Coronavirus Test is an automated in vitro diagnostic test for qualitative detection of nucleic acid from coronavirus, which is performed on Gene Expert instrument system. As Dr. Faris said just now. So
Gene
the Gene
Expert
Expert
tu brand name If you nak tulis Gene Expert, it's X without E Sebab dia memang brand name Gene Expert, bukan Gene Expert, E Expert. Gene X huruf besar Expert lah. Dia brand name.
Okay. Alright. Okay, so the Gene Expert instrument system automate and integrate sample preparation, nucleic acid extraction and also amplification and detection of the target sequence in simple or complex samples using the real-time PCR assays, and which we can get the result within 1 hour lah. So the Expert Express coronavirus test provides test results based on the detection of 2 gene targets, which is N2 and E gene, and also internal controller, we call it as IC. Okay, a correlation study between the 2 targets and 1 target N2 only has been carried out in IMR, Ministry of Health, and also we showed a sufficient correlation. Okay, the sample processing control and probe check control also included in the cartridge utilized by the Gene Expert instrument. However, for the QIA Stat DX Respiratory Coronavirus Panel, this one is a multiplex nucleic acid real-time PCR test which can detect the nucleic acid from 22 respiratory viral and bacterial organisms, including the coronavirus. The coronavirus in this panel targets 2 genes of the virus genome, especially the RDRP and E gene, which is detected with the same fluorescent channel. So the 2 targets are not really differentiated, and amplification of either or both regions leads to a fluorescent signal. The test cartridge includes a full process of IC, which verifies all steps of the analysis process, which including the sample resuspension, lysis, nucleic acid purification, and also reverse transcription and PCR. Okay, so the indication for using Gene Expert and RMT is for rapid PCR testing, which should be considered in high-risk patients where an urgent result is required within 1 to 4 hours. This one, I took it from
Don't worry. This is a guideline lah. The guideline have some changes since it's been published. So don't worry too much about whatever specialist ke apa. Okay, carry on.
Alright. Okay, for the testing criteria, how we take for the RMT Gene Expert for which type of cases is for critical ill patient with a recent onset of respiratory symptoms or pneumonia, following the updated existing guidelines of infection prevention and control in clinical management of SARI or pneumonia to rule out COVID-19. And also for any urgent transplant cases, we can convert the PCR into RMT or Gene Expert. And also patient who is brought in dead cases with high probability or high suspicion of COVID-19, we can convert the PCR to RMT or Gene Expert, requested by the forensic pathologist or emergency physician, preferably following discussion with the microbiologist. And also we can convert the RMT engine expert is for urgent cases other than above lah, upon consultation with the medical microbiologist by ID physician or ID physician. Okay, we can also convert it in urgent cases lah, which the choice of test between rapid molecular platform and Rtk antigen depends on the indication and availability of the test. Okay, what are the type of specimen transportation we take? For gene expert, it's the same only as PCR with the nasopharyngeal swab and also nasal wash or aspirate. And for QIA test, we take the nasopharyngeal swab only. And then for the transport media, gene expert, we send the nasopharyngeal swab in viral transport media. And however, the nasal wash or aspirate, we send in sterile container. The QIAS test, we transport the media of the nasopharyngeal swab to universal transport media. So the packaging both also same, we have to do as triple packaging, and the transportation for gene expert, we have to maintain the sample to 2 to 8 degrees up to 72 hours. Same as QIAS test as well also lah, we have to maintain 2 to 8 degrees Celsius up to 72 hours. So after do the test, all the samples must be autoclaved or incinerated. Okay, so this is the flowchart and result interpretation for the gene expert coronavirus.
Tak perlu go into detail lah, just carry on. Lagi kecil semua tak nampak.
Okay. Next is for the QIAS DX respiratory coronavirus panel. This is the flowchart. We request for rapid PCR. Then we collect the nasopharyngeal swab specimen and
place it. Boleh skip lah ni. Ni tak perlu lah go into detail.
Alright. Okay, so reporting
tak perlu into detail lah. Basically this is all what yang lab buat lah. Kena enter dalam SIPCA, quality control apa semua. So ada soalan tak kepada Chia? Ceng. Alang-alang, tak ada saya tanya. So, what is the significance of CT value, Chia?
CT value, we detect the sensitivity, the specificity of the infection, like highly infectious. If the CT value, we can see to detect
when people say, so is high CT value good or low CT value good?
The high CT value is good. The low CT value more infectious.
Okay, so put it in terms that semua orang boleh understand. Why low CT value is not good? Why is low CT value, as you said, is indicates that patient is more infectious?
Jangan doktor.
I mean, kalau ada kawan-kawan lain selain daripada Dr. Mashi dengan Dr. Husna lah, yang you know think they can explain why low CT value indicate patient more infectious, boleh sila boleh teruskan, boleh tolong dia.
Definition. Threshold. Low threshold lah indications.
Yeah. Belah tutup mic ya. Okay, so kita nak meneruskan, kita ada dua lagi presentation kan. So CT value, CT ni merujuk kepada cycle threshold. So first itu yang korang kena faham pasal PCR ni. PCR polymerase chain reaction ni, how it works. Polymerase chain reaction test ni, it works by amplifying the genetic material dalam yang for the virus that you need to test lah. That's why PCR ni, first you have to isolate the genetic sequence of the virus. Then bila you dapat sample, what you're trying to do is try to amplify the genetic material tu until you can detect it. So cycle threshold ni merujuk kepada, if you can think of it, macam microscope lah. 1 amplification, 2 time amplification, 3 time amplification, 4 time amplification, dan seterusnya. So the lower CT value indicates higher viral load, because the more virus you have, the less that you need to magnify or amplify the genetic material. Say you have 1000 viruses, so you probably need to macam, do 3 or 4 cycles, then you dah dapat genetic material. Then if you have, say, from 1000 you have 10 viruses, so you may to amplify further, macam 4 times dah nampak, 5 times dah nampak, 6 times dah nampak, 7 times dah nampak, then 30 times, then you detect the virus. It's enough amplification, then your CT value will be higher lah, because you amplify banyak kali kan. Then it indicates that you have lower viral load, so that's why you need higher cycle threshold to be able to detect the virus lah. So that's how PCR works lah. So basically, the lower the CT value indicates the higher the virus, because you don't need to amplify or you don't need to magnify as much before you're able to detect the virus. So konteks yang sama juga, if you allow the amplification to occur infinitely, say you allow the CT value to, the cycle to run, say, sampai 80, 90 or 100 cycles, then eventually you will be able to detect the virus, because mungkin virus tu dah mati, tinggal kaki dia je ke, or tinggal a very small part of dia punya genetic material, tapi because you amplify sampai 100 times, 150 times, then you able to detect the genetic material of the virus. So this is what we learn initially kan. Initially, kalau if you remember 2 years ago, memang PCR ni is the gold standard for detecting or diagnosing COVID-19. Tapi what people don't realize then is CT value ni dia ada cut off. You remember tak the Malaysian athlete yang mula-mula dulu kan, zaman mula-mula COVID tu kan, before somebody with COVID is discharged, dia punya PCR needs to be negative 3 times. Tak tahu lah whether you guys remember or not. This is the before masa first PKP dulu. 2020. Early April 2020. Then you got one Malaysian athlete positive COVID-19. He was swabbed 60 kali and his PCR still turns out positive. So sampai sudah dia tak boleh keluar, dan eventually they let him out lah. Tapi what people don't realize is you ada cut off CT value ni. Your cut off of CT value is around 36 something 40. So if your CT value is more than 40 or more than 36, dah considered negative. Sebab because it just meant that you've been amplifying too much. So dulu they just let the CT value berapa pun kira positif, as long as positif, tak ada cut off. Tapi after more research have come out, the CT value around 36 to 40 tu dah considered, more than that is considered negative already. And that's why nowadays, once you dah buat PCR sekali, you're not supposed to have another PCR in the next 3 months kan? Tak?
Ya, betul.
Because
for 90 days.
Sebab now the criteria is once you positive, you're quarantine for 10-14 days, settle. No need to repeat PCR, no need to do RTK. And especially even if you ada symptoms ke apa lepas tu, they don't do PCR for you. Ideally within the next 90 days. Sebab what happen is virus tu mungkin dah mati. Tapi biasalah macam apa harimau mati meninggalkan belang, manusia mati, whatever lah peribahasa tu kan. So the virus left its genetic material lah. Dia dah mati kan, tinggal kaki, tinggal tangan, tinggal apa-apa lagi. So if you do PCR in patient yang previously PCR positive, there's a chance that this genetic material yang kecil-kecil, yang lebih-lebih, you know, yang break up for the virus, yang akan be amplified. And that's why your PCR will be positive. That's why nowadays no repeat PCR after 90 days. Up to 90 days lah if you're positive. Because sebab if you buat, if turns out positive, it's gonna create confusion lah. So you don't know whether this is just remnants from previous infection or whether this is reinfection. Sebab in the early days of COVID ni kan ada at one point kecoh-kecoh pasal reinfection kan, higher risk of reinfection. Tapi what they realise now bukan reinfection sebenarnya, because they've been doing PCR for patient yang previously positive. So they detect the remnants of the dead viruses. That's how, because benda ni so new, even you know all this PCR pun we still learning. That's why the guidelines ni ada variations and revisions. Rasanya sampai 5th, 4th and 5th revisions lah the guideline. And pasal PCR, that's why you need to understand about kita nak suruh you faham pasal PCR ni, so that bila you interpret or bila you nak order, you order with, you know, knowledge of what you're doing lah, bukan just randomly order PCR for everyone. So if patient tu dah previously COVID positive, PCR positive, and say selepas sebulan he had symptoms, and somebody yang bijaksana telah order PCR and the PCR is positive, how do you know whether this patient having active infection or having reinfection, or it's just, you know, remnants of the dead viruses yang menyebabkan dia positif? Anyone can answer, kecuali Dr. Mashitah dan Ismail.
When patient having the symptoms continuously?
Tak, maksudnya patient dah say lepas sebulan, patient discharge well lah. Cat 1, PCR positive, discharge well after 14 days. Then sihat kat rumah, say after about a month, they develop some runny nose lah, and some bright person decide to do PCR. It turns out to be positive. So how do you know whether this is actually reinfection of COVID, or it's just, you know, they detect the dead viruses? What are the tests that you can do to differentiate between these two?
Can take Rtk again also.
No, why not Rtk? So if Rtk negative, means that what? Bukan reinfection.
Sebab sini yang buat Rtk ni.
Okay, what we can do, we can send a titer, send antibody titer to see. Dia ada test lah that you can send untuk tengok, you basically check for a titer lah, antibody titer. So if it's reinfection, your antibody titer will be higher lah. Dia akan spike balik. So, but what I'm trying to get at is, if you tak tahu, you cannot repeat PCR, you know, within 3 months after first PCR positive, takut you're gonna end up creating all this confusion lah. Okay, sekarang nak label patient positif ke, nak label patient infection ke, nak label patient dead viruses ke, then you you akan create confusion and waste a lot of resource lah. Then you have to send for antibody titer, serum level lah dan sebagainya. So be aware lah pasal benda-benda ni. So that's why walaupun benda ni banyak lab yang buat, tapi sometimes this kind of thing kita kena aware jugalah, kita kena tahu pasal a bit about our testing method so that we know the limitation of our test. Okay?
Okay, betul.
Setuju ya? Kalau tak, kita boleh teruskan lah kot ke
Sikit je.
Ha,
So I think I just already elaborate scientific part of your part. Just want to I just want to highlight regarding the management part dekat ED kita lah, regarding to highlight to all of you regarding our lab RTK dekat ED tu, our services lah. So starting from this week kita sampai office hour. During office hour, during weekdays office hour saja sampai 5 PM. Weekends sampai 3 PM. Dan the branch 1 to 2 at 2 PM. Macam itu saya tengok.
Line putus-putus lah Kak Mashi.
Putus
Kak Mashi cakap macam putus-putus.
Dengar tak?
Ni clear.
Okay. So the lab RTK ED lab services yang dekat luar tu sebelah Asma Bay tu So starting from this week, they only provided the service during weekdays, office hour only until 5 PM. Weekend sampai 3 petang. So 1 to 2 PM they're having their lunch. So kalau macam semalam tu ada few patients yang you all hantar 1 to 2 PM kan, you hantar because the lab dekat RTK lab kat bawah tu dia tak provide services. So you send the patient the sample to makmal yang utama tu. Yang tu ambil masa so kalau betul-betul urgent saja you hantar within office lunch tu. Otherwise kalau boleh you just keep the sample, hantar dekat kita punya RTK lab ED tu lah, dekat luar tu kan, because the result is more faster. Kalau you hantar awal tu biasalah, even though it's RTK, it's going to take quite some time. Okay, even if it's really urgent then you send upstairs. Kalau tidak you tunggu pukul 2 tu lah. Okay, and then this is teguran daripada one of the infectious control doctors which did dia buat round masa one of the day tu dia nampak one of the housemen take swab without wearing proper PPE, pakai surgical mask sahaja. So hopefully you are wearing an appropriate PPE especially while taking swab. Okay. And then regarding RMT dengan gene expert, that is as macam ikut guideline tadi kan, specialist sahaja yang akan talk to pathologist. But please kadang-kadang specialist ataupun MOs kadang-kadang tak sempat. Okay, one of the indication for RMTs in emergency EDHSAH is when the patient is SARI patient, RTK negative, but the patient required face mask oxygen and above. That is one of the indication for you to macam ingatkan you punya MO dengan specialist to proceed with RMT. Okay, sebab sekarang ni RMT banyak, RMT dengan gene expert, the supply is quite okay lah. Okay, not to say kita nak overuse, nak abuse. Okay, but that is the indication at the moment for EDHSAH lah, dekat hospital HSAH. And then another one is regarding BID cases. BID cases, please confirm with your superior atau your MO or specialist regarding which type of yang you nak hantar. It's only RTK ke ataupun you hantar both. Jangan hantar dua-dua. We got cases yang hantar dua-dua RTK balik, kita dah release pun patient to community, and then PCR come back after 2 days become positive. So you have to really confirm with most of the time if the patient presented to you BID, for example MBA ke apa kan, which doesn't have any related to COVID-19, you tak suspect patient ada COVID-19 kan, tak ada SOB, tak ada fever, not from cluster area, so RTK is enough. Kalau patient you suspect is COVID-19 COVID-19 ada SOB, ada fever from cluster area, pakai gelang. Kalau pakai gelang tu dia dah buat PCR lah. So you have to wait for the PCR. Tak payah proceed dengan yang lain lah. Kalau patient yang you memang suspect the patient is having COVID-19, then that one EP most of the time will order RMT or gene expert RMT. Okay? Okay, that's all.